So hello guys, our today's subject is dental anatomy. Let us discuss the MCQ on the subject anatomy. The first question is the angle of mandible in the parotid gland it is supplied by. Well, the angle of mandible in the parotid gland it is supplied by greater auricular nerve. So remember, the skin over the parotid gland and the angle of mandible it is supplied by the greater auricular nerve. So remember this. This one is the great auricular nerve. So this nerve it arises from the ventral rami of remember second and third cervical. So C2 and C3. So this great auricular nerve it arises from the ventral rami of the second and the third cervical nerves, and it is a branch. It is a branch of cervical plexus. So it will provide sensory innervation to skin over the parotid gland and the angle of mandible. So this region is this one is the parotid gland, and this great auricular nerve will supply the parotid gland as well as the angle of mandible. So the great auricular nerve it originates from the cervical plexus, from the ventral rami of the cervical spinal nerves, that is C2 and C3. So after its origin, the great auricular nerve it will run obliquely and outward across the sternocleidomastoid muscle, that is a large neck muscle. So it runs superficially along the muscle. As it ascends, the greater auricular nerve approaches and passes over the angle of mandible. So greater auricular nerve supply the angle of mandible. So it gives off branches in this region that will provide the sensory innervation to skin over the angle of mandible. Continuing its course, it reaches toward the external ear. So it sends branches to the posterior part of auricle and skin over the mastoid process of the temporal bone. The another branch of great auricular nerve extends toward the parotid gland, that is situated in the front and below the ear. So as its name is great auricular, reflects that its significant role in providing sensory innervation to the ear. So remember, for your exam point of view, this great auricular nerve will supply angle of mandible, external ear, and the parotid gland. The other option, ophthalmic, maxillary, and mandibular nerve. The mandibular nerve, it is one of the three divisions of the trigeminal nerve, and it supplies the sensory innervation to the lower jaw. The maxillary nerve, it's another division of trigeminal nerve. So the trigeminal nerve gives branches ophthalmic, maxillary, and the mandibular. So the maxillary division will supply the upper jaw and the surrounding areas, including the upper lip, cheeks, and part of nose. And the ophthalmic division it provides sensation to the forehead, scalp, upper eyelid, and front of the scalp. Moving to the next question. The crista galli it is a part of. Well, the crista galli it is present on the ethmoid bone. So what is crista galli? So this region, this part of ethmoid bone is the crista galli. So it is a delicate, complex sponge-like bone that is located in the skull. So think of this as a bone spike sticking up from the cribriform plate. So similarly here on the skull, this part will represent the crista galli. Now what are the parts of ethmoid bone that you should know? The parts of ethmoid bone are the cribriform plate, crista galli, labyrinth, superior and middle nasal conchae along with the ethmoid sinus. The cribriform plate, this plate is like a thin wall that separates your brain area from your nose area. So the cribriform plate, it has tiny holes in it, and your sense of smell nerves go through these holes to help you smell things. Second is the crista galli. Think of this as a bony spicule that is sticking up from the cribriform plate. So it does not have a big job, but it helps to keep the brain's protective covering in its place. The other is the perpendicular plate. So this one area will represent the perpendicular plate. Imagine a flat, thin piece of bone that is hanging down like a curtains between your nostrils. So this parts helps to divide your nose into left and right side. Other are the labyrinth. The ethmoid bone looks like a bit like a sponge with lot of tiny pockets. So these pockets helps to make the air you breathe in your nose warm and clean. Other are the superior and middle nasal conchae. So this one is the superior nasal concha and middle nasal concha. So these are just like a shelf inside your nose that will make the air you breathe swirl around, which cleans and warms it before it goes deeper into your nose. The ethmoid sinuses, they are just small empty spaces inside the bone that are connected to your nose. So these are the parts that what makes your face feel stuffed up or congested when you have a cold. So the crista galli is a part of ethmoid bone. That's your answer. Coming to the next question, a patient following the peridectomy. It feels numbness on face that is present while shaving. It's due to the injury of great auricular nerve. We discussed earlier that the great auricular nerve, it originates from the ventral rami of second and third cervical rami, and it will provide sensory innervation to skin over the parotid gland, angle of mandible, and the external ear. So during peridectomy, what a dentist do, the most commonly incision that a oral surgeon will give is the modified Blair incision. So that starts in the front of ear, underneath the earlobe, and down into the cervical crease that is used to get access to the parotid gland. So we know that the great auricular nerve will provide sensation of skin over the parotid gland. So if during peridectomy, that is during this incision, if this nerve get injured, it can result in numbness in the area around the shaving site. That will corresponds to the sensory distribution of the greater auricular nerve. So option A is correct. Option B, well, is mandibular nerve. The mandibular nerve, as we know, it is one of the division of which nerve? It's the trigeminal nerve that supplies sensory innervation to lower jaw, that is the mandible, including lower lip and chin. The injury to mandibular nerve might cause numbness in the lower part of face, but it is less likely to affect the area typically involved in shaving, which are higher up on the face. Option C, facial nerve. Well, it's control the muscle of facial expression. During periodictomy, there is risk of injury to the facial nerve, but rather that would result in facial weakness or paralysis rather than the numbness. The other is the auriculotemporal nerve. It is the branch of mandibular nerve, division of that is trigeminal nerve. So it is very less likely to affect the areas involved in shaving. So your answer is greater auricular nerve. Moving to the next question. A 68-year-old woman, she is suffering from sudden bouts of pain over the area of her midface. Laboratory studies that she has epidural neuralgia, that is the involvement of the trigeminal, that is trigeminal neuralgia. So which ganglion is the location of neural cell body of the nerves mediating this pain? Well, your answer here is Gazerian ganglion. So remember, the other name of Gazerian ganglion is the semilunar ganglion. So it is the location of the sensory neuron cell bodies of the trigeminal nerve. So first of all, you should know what is a Meckel's cave. Meckel's cave, it is a small hollow cavity inside your skull, specifically in area that is the middle cranial fossa. So this cave serve as a protective enclosure within the skull, and it is situated near the base of skull. The ganglion associated is the Gazerian ganglion or trigeminal ganglion or the semilunar ganglion. It is a bundle of clusters of nerves bodies that are located within this Meckel's cave. So it is an important part of trigeminal nerve, that is the fifth cranial nerve. So Meckel's cave is just like a small room inside your skull. Inside this room, you have Gazerian ganglion, that is the collection of the nerve cells. So this Gazerian ganglion, it is the part of trigeminal nerve. So that is responsible for feeling things on your face. So when you touch your face or feel pain in your face, the signals from these sensations travel through the trigeminal nerve, including the nerve cells in the Gazerian ganglion, then to your brain. So Meckel's cave, it is a space in your head where important bunch of nerve cells live, and they help you feel things on your face by sending messages to your brain through trigeminal nerves. So your answer here is Gazerian ganglion. Option A, geniculate ganglion. Well, it is associated with, geniculate ganglion is associated with, remember, facial nerve. So it contains the cell bodies of sensory neurons for the taste sensation from the anterior 2/3 of tongue. So it will not be associated with the pain that is associated with the trigeminal neuralgia. Option B is Gazerian ganglion. Well, yes, it's the correct answer. Trigeminal neuralgia, it is a condition that is characterized by bouts of pain over the distribution of trigeminal nerve branches. So answer is B. The inferior glossopharyngeal ganglion, it's associated with the ninth nerve, that is the glossopharyngeal nerve. The otic ganglion, it's associated with the glossopharyngeal nerve. So your answer of choice is Caesarean ganglion. Moving to the next question, the Meckel's cave, it is related to the trigeminal ganglion. So answer is clear, already discussed. Answer is B. Which of following is the junction of frontal, parietal, temporal and greater wing of sphenoid bone? Well, the answer is pterion. So pterion, it is junction of four bones. Which four bones? This one is the frontal bone. This one is the parietal bone. This one is the sphenoid bone. And this one is the temporal bone. So four bones. Remember, frontal, parietal, temporal and sphenoid bone. It's the pterion. Option B. Now what is lambda? So all these images are taken from your standard textbooks through open Google source. This one is the lambda. So lambda, it is a point where the sagittal suture that separates the two parietal bone meets the lambdoid suture that separates the parietal bone from the occipital bone. The inion, it's also known as external occipital protuberance. The protrusion at the back of skull where the occipital bone will meet the neck, it's the inion. Vertex, it is the very topmost portion. The topmost portion of the crown of skull is the vertex. So answer here is pterion. This question is very important. Many times asked in your exam. Answer is pterion. Next question, Turkish saddle is related to which point? So this one is a Turkish saddle. So it will resemble this structure, that is sella turcica. So sella turcica, it is a saddle-shaped depression that is present within the sphenoid bone. Which bone? Sphenoid bone. And it's the deepest part is known as hypophyseal fossa. So answer is hypophysis. So this fossa will house the pituitary gland, that is also known as hypophysis. Hypothalamus. So this one is the hypothalamus. It is the region of brain located just above the sella turcica. So this part plays an important role in regulating the physiological process like hormone secretion from the pituitary gland, and it is not actually located within the sella turcica. The uncus, it is a specific part of the temporal lobe of the brain located within the cerebral cortex, and this part is associated with functions like memory and emotions. Amygdala, it is a almond shaped cluster of nuclei located deep within the brain. So its function is emotional processing, memory and perception of emotional stimuli. Moving to next question. Superior ophthalmic vein, superior orbital fissure, it contains all except so answer is ophthalmic nerve. So option A is superior ophthalmic vein. So superior ophthalmic vein includes the superior orbital fissure, does include transmit the superior ophthalmic vein. So this vein is important venous structure in the orbit, and it drains blood from the superior aspect of eye and forehead. The inferior ophthalmic vein so this structure drains blood from the lower aspect of eye. Option C is ophthalmic nerve. The ophthalmic nerve itself does not pass through the superior orbital fissure. Instead, the superior orbital fissure allow passage of three branches of ophthalmic nerve, which are the lacrimal nerve, frontal nerve, and the trochlear nerve. So an easy mnemonic to remember it is LFT. So option C is correct. Nasociliary nerve. Nasociliary nerve, it is a branch of ophthalmic nerve that pass through the superior orbital fissure. It carries sensory fibers and provide innervation to the nasal cavity as well as the cornea of the eye. So your answer here is C. Moving to next question. All is true about the trochlear nerve, except. Well, the trochlear nerve, that is the which nerve? Cranial nerve 4. Trochlear nerve, it innervates the contralateral superior oblique muscle of eye. So this innervation is responsible for superior oblique action of depressing the eyeball and causes intorsion. Intorsion means inward rotation. Second option, it causes depression of eyeball in adducted position. So the trochlear nerve main function is caused to depress the eyeball when the eye is in adducted position. So that action would make the eye to look downward and inward. The trochlear nerve, it passes through superior orbital fissure, but it stay outside the annular tendon, also known as ring of Jin. So that option is also correct. In case of trochlear nerve, the lesion, the patient typically attains contralateral head tilt, not the ipsilateral head tilt. So this head tilt, it is a compensatory mechanism to elevate the double vision that occurs due to the paralysis of superior oblique muscle. So by tilting the head to the opposite side, the patient aligns the eye more vertically, reducing the severity of diplopia when looking down. So the answer is D. The joint that is involved in movement from movement of head from left to right, it's the answer is A, atlantoaxial joint. Well, the yes movement that involves the nodding of head up and down. So this movement, it is primarily controlled by which joint? Atlanto-occipital joint. That is located between the base of skull, that is the occipital bone, and the first cervical vertebra. That is, which one is the first cervical vertebra, it's the atlas or C1. So that allows the head to move forward and backward movement, to creating the nodding motion. On other hand, the no movement, that is shaking the head to left and right, that is primarily controlled by atlantoaxial joint, that is located between the first cervical vertebra and second vertebra, that is the atlantoaxial joint. So that promotes the rotational movement of head, allowing you to turn your head from side to side. So your answer is atlantoaxial joint. Which of following is a separate bone? The answer is inferior nasal concha. Well, the superior nasal concha, it is not a separate bone, it is a part of the ethmoid bone. The middle nasal concha, it is also a part of ethmoid bone. So the middle nasal concha along with the superior nasal concha helps to increase the surface area within the nasal cavity to improve the air conditioning, whereas the inferior nasal concha, it is a separate bone. There are two inferior nasal concha, one on each side of the nasal cavity. The crista galli, it is not a separate bone, it is a bony projection that extends upward from the ethmoid bone within the skull. So mark your answer accordingly. The cranial nerve that is related to petrous, apex of petrous temporal bone, it's the cranial nerve 6. It's abducens nerve. Abducens nerve, it is related to apex of the petrous part of the temporal bone. The abducens nerve, it arises from the pontine medullary junction and exit the brainstem at the junction of pons and medulla. It then passes through the apex of petrous temporal bone before entering the cavernous sinus. So the lesion or compression at this point, it can lead to problem within eye movement, like the ability of eye to move outward, resulting in horizontal diplopia. So answer is D. Next question, the structures that will pass through the internal auditory meters, they are all except
चले अब
चलते हैं, बस 15 मिनट दे मेरे को, आ रहा हूँ. The first option is nerve of Rysberg. So nerve of Rysberg, it is a component of the facial nerve, also known as nervus intermedius. It carries sensory fibers and it is responsible for taste sensation from anterior 2/3 of the tongue. The anterior inferior cerebellar artery, it does not pass through the internal auditory meters. Well, remember, it is a branch of basilar artery, and it supplied blood to the anterior inferior part of the cerebellum. The superior vestibular nerve, is one of the two branches of the vestibulocochlear nerve that carries sensory innervation from semicircular canals in the inner ear. It passes through the internal auditory meatus. The cochlear nerve, it is other branch of vestibulocochlear nerve, and it passes through the internal auditory meatus. So answer is B. Mark your answer of choice. Incisive foramen transmit. Well, the incisive foramen, it will transmit greater palatine artery and the nasopalatine nerves. So the incisive foramen, this foramen, it is located behind the central incisors in the incisive fossa of the maxilla. The nasopalatine nerve, that is responsible for providing sensory innervation to anterior part of the hard palate, including the mucous membrane, and along with the greater palatine artery. The structures that pass through tendinous ring of Zinn. The answer is C, nasociliary nerve. The nasociliary nerve, that is branch of ophthalmic nerve, it passes through the tendinous ring of Zinn. So this one is the tendinous ring of Zinn. The lacrimal nerve, it does not pass through this ring. The trochlear nerve also doesn't pass through this. The superior ophthalmic nerve, ophthalmic vein, does not pass. So your answer is nasociliary nerve. The thinnest bone is part of which bone? The thinnest bone is part of ethmoid bone. Ethmoid bone, it is the thinnest bone. It is delicate, spongy bone, and it is papery thin structure with the numerous perforation along with you see bony projections. Sutures that is present between the parietal and occipital bone. This question we have already discussed in the explanation part. It's the lambdoidal suture. So it is situated on the posterior aspect of skull and it connects. So this one is the parietal bone. It connects the two parietal bone with the occipital bone. So this area shown is the lambdoid suture. The sagittal suture. So this is the sagittal suture. It runs along the midline of skull and separates the two parietal bone. So sagittal sutures will separate these two parietal bones. The coronal suture. This one is the coronal suture. It runs horizontally. It separates the frontal bone, the two frontal bones from the two parietal bones. Metopic suture. So this one is the metopic suture. It runs in the midline of the frontal bone. So it is commonly seen in the infants, and it fuses as the person grows. The bone fuses at single frontal bone. Which of following attains adult size before the birth? The answer is ear ossicles. The ear ossicles consisting of malleus, incus, stapes, they are almost of adult size at birth. So remember that. So these bones play a role in the transmission of sound vibration to the inner ear. So these are well developed and functional shortly after birth. Next question. The palatine tonsil, it develops from which pharyngeal pouch? It develops from second pouch. So remember the table. The first pouch gives tympanic cavity, auditory tube. Remember all these structures. The inferior parathyroid gland comes from the third pharyngeal pouch from the dorsal part, and for the ventral part is the thymus gland. From the fourth pouch rises superior parathyroid gland, and for the fifth pouch is the ultimobranchial body. Sylvian point is related to which part of the temporal bone? It is related to the squamous part of the temporal bone. So the points correspond to the pterion, that is present point on the lateral aspect of skull where the four bone meets. So this Sylvian point is important because it is located on the middle meningeal artery. So it is located over the underlying medial meningeal artery, and fracture in this area can lead to epidural hematomas. Modulus at the corner of mouth is formed by all of following muscles except. The answer is D, Aleknese. So modulus it is a point at the angle of mouth where the various muscles meet, like the buccinator, orbicularis oris, levator anguli oris, depressor anguli oris, zygomaticus major, risorius, platysma. So which muscle is not involved is the Aleknese. The facial artery does not supply the answer is the facial artery does not supply the answer is external auditory meatus. The facial artery does not supply the external auditory meatus. The external auditory meatus it is supplied by the branches of external carotid artery, such as posterior auricular artery and superficial temporal artery. The lower part of nasal septum, the facial artery does supply the lower part of nasal septum through branches like the superior labial artery. A submandibular gland, the facial artery supply the submandibular gland, that is like the submental artery provides blood supply to the gland. The facial artery does supply the blood supply to the tonsils. So your answer is C. The first branch of inferior ophthalmic vein passes through which foramen? The answer is inferior orbital fissure. So inferior ophthalmic vein, it passes through this foramen. Which of following receives blood supply from the foramen lacerum? The answer is vein of pterygoid canal. So remember the foramen and structure passing. The posterior elevation and retraction of tongue, it is done by which muscles? So retraction and elevation of posterior 1/3 of tongue, it is done by styloglossus and palatoglossus. Depression done by hyoglossus, genioglossus on both sides. Retraction, it is done by styloglossus muscle and hyoglossus on both sides. Protrusion of the tongue, it is done by genioglossus on both sides acting together. So remember all these options.